Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to share with you 3 essential tips to avoid aggravating your pain and causing damage to your degenerative discs while working out. Hope you enjoy. So, having a 90+% success rate with degenerative disc conditions of the lower back and neck and mid-back in terms of getting my patients back into exercise without hurting themselves over the last 25+ years. I can tell you that the 3 tips I'm going to share with you today are essential for working out without being in pain. There's no reason why you still can't stay fit even though you have a degenerative disc. The secret is learning how to use your body. You know, most exercise programs, and even lower back and neck strengthening and pain relief exercise programs, are generic in nature. They try to use the same exercise for everyone. And really what happens is most of those programs only strengthen our unique dysfunctions. We all have postural problems, mechanical problems in our bodies that are actually one of the prime reasons why our discs became degenerative in the first place. So we don't want to use a generic exercise program that's just going to strengthen those same postural patterns, those same mechanical error patterns that are going to place more stress on our disc. We want to get a unique, specific exercise program and a way of holding our body, which is our #1 tip today, which is spinal stability, in a unique way so as to avoid aggravation. Let's take the lower back, for instance. If you have a tendency to have lower back pain aggravated leaning forward or leaning backwards or leaning to one side more than another, you want to hold your body in such a way where you prevent that particular motion, even if it's just a millimeter going that way. You want to hold your spine in a neutral position to avoid that particular tendency. Otherwise, you're going to keep compressing the body. For instance, a lot of people I have with degenerative disc problems in the lower back have problems bending forward. So they always wonder why they get into trouble when they do things like rows, like squats, like deadlifts, okay, where the tendency is for the lower back to move forward. Same thing with yoga poses like down dog. When you're down in the position on all fours and you're trying to emphasize stretching the back out by going into more and more flexion, all that's going to do is increase the load on the discs in flexion and aggravate your pain. Okay, all those positions can be done, but they have to be done from a unique perspective for your body. People whose lower backs are aggravated with extension wonder why after shoulder pressing, okay, or lat pull downs, okay, or any type of exercise where they're jumping or moving and there's extension in the lower back, a backwards bending, their pains are aggravated. They're not using their abdominals correctly to prevent that excessive extension. So by spinal stability, we want to find a neutral zone for our lower back and our neck that holds it in a protected position so it doesn't get into those extremes of motion that start tearing and pressurizing those disc fibers or aggravating the arthritic joints that are usually associated with the degenerative disc. So let's just go through a mini analysis on our lower back and neck to determine where your spinal stability may be. If you have a tendency to have pain leaning on one side, or if one side of your hip comes up and you feel the pain, that especially is something when we're on one leg, or if we're in a split stance, meaning any exercise where the leg is forward, we want to keep that hip down and the rib up on that side. That's going to avoid the insulting compression on that side. If we have a tendency to have pain moving forward, we want to make sure that we hold our core, meaning our lower abdomen pulling in towards our spine, correcting any type of side or twisting alignment problems in our back. We're going to hold our spine in a neutral square structure. You have to do a little posture analysis on yourself to determine that. And we have one of those on the Pain Free and Fit website if you're not sure. You can go through the steps there and find out on your own body analysis what your unique problems are. If we bend forward, we want to make sure that motion comes from our hip joint. So for instance, even little things like picking up a dumbbell from a rack, we want to make sure we're bending from our hip, okay, where our leg meets our socket. You can see that's like a squatting motion. That is recreating no motion in my lower back going forward at all. Now I can go way down to the floor, okay? It's all in the hip joint. I'm not bending from my lower back. That's spinal stability. We want to hold that tension of lower abdomen in and then bracing the abs as if we're going to get punched as we think. No forward bending there. All the motion is coming from the hip. Okay? If we have a problem with extension, We especially want to create a little abdominal tension and even hold a little tailbone under. Okay, you see that little motion? I'm tucking my tail under and crunch down with the abs. Now if I go to shoulder press, reach up, jump, my abs are more engaged. It's preventing that extension in my back. That's going to save me from insult. Okay. For the neck, we want to make sure that the shoulders aren't rounded. If you notice on our body analysis, looking in the mirror, that you have a tendency to round one shoulder, you want to hold that back because the muscles from the shoulder blade attach to the neck. That can tug and irritate your degenerative discs. If you're like most people and have a tendency to have a forward head posture where your ear is in front of your shoulder, you want to pull the face towards the back of the head. That opens up the back of the spine, holding it in a more neutral position. Okay? So you don't aggravate the disc and the joints that are degenerative in that area. Same thing if you have a tendency to side tilt to one side, if you have a tendency because at work or at home you look more to one side, if you have a tendency to have your head turned to one side or tilted, you've got to get that more straight and a better alignment so you're not torquing that disc while you're exercising. So spinal stability is the first tip. Keep it in mind, avoid those problems as you're doing your exercises. Tip number 2 is compression. Most degenerative discs are aggravated by compression. When we sit, we put 12 to 13 times our body weight on our lower back discs. So many people, if you have an option to press overhead, to pull with a lat machine, okay, even to curl, standing is a better option because you're not compressing the lower back. Okay? If you are squatting, have a bar across your shoulders, or if you have dumbbells or a hex bar in your hand, and you're doing deadlifts or squats, that's pulling your arms down with weight, compressing the lower back. Much better to use a one-legged squat, okay, which puts more stress on your leg and hip muscles working out, but it relieves your back from compression, okay? One-legged squat is the same form as a good squat. You notice my hips going back, my knees not coming forward beyond my toes, and I'm avoiding the typical mistake of hip hiking and rib leaning on a one-legged squat. I want to keep my hips level and my ribs level by keeping the standing side open, hip and rib held apart. If I have a tendency to lean back and I'm curling, for instance, or I'm doing an upright row, or let's say I'm doing a clean press, I want to make sure that I use one leg behind me. Okay, that acts as a strut that prevents my spine from extending back. It keeps me in better alignment so I can do these motions without the tendency to lean back from my waist. That leg struts my body up and keeps my core and my spine in that neutral position we talked about. And finally, tip number 3, we want to avoid rotation of the low back, okay, because that's one of the prime movements that can aggravate discs. And by that, what I mean is we always want, when we turn or twist, to keep our belly button and pubic bone facing the same direction. We get into trouble, okay, and this can happen with abdominal exercises, it can happen with chops, it can happen with diagonal presses across. We always want to keep our belly button and pubic bone turning the same amount. If I need to twist further, I'll twist from my shoulders, which then rotates my upper spine, but leaves my lower back immobile, because the lower back kind of corresponds to where your belly button goes. Okay, so you notice when I turn, I'm moving my hips, okay, if my belly button follows my pubic bone, and then my shoulders move, hip and shoulders move, but low back, there's no neck twist or torque in there. That's going to help you avoid pain from rotation. So if we keep these 3 tips in mind, holding a neutral spine while exercising, avoiding compression, okay, and number 3, avoiding rotation at the lower back especially, much more than the neck. The neck is designed to rotate, the lower back isn't. We can help avoid a lot of problems. So if you want more information on any of these things, feel free to subscribe to our channel. We've got all kinds of great exercises that go into more depth with keeping you out of pain and getting you back into shape. You can also learn some more analysis and corrective exercises at the Pain Free and Fit website. Or if you have any questions or comments or any ideas for a future video on a specific topic or idea you like, please leave a comment in the comment section and I'll do my best to answer your questions.